Hello, my name is Professor Alison McMillan and I'm the Chief Nursing and Midwifery Officer at the Commonwealth Department of Health and Aged Care. Before I begin, I'd like to acknowledge the Ngunnawal people as the traditional custodians of the lands on which I'm talking to you today. I'd also like to extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander people listening. This week is Cervical Cancer Awareness Week. So, did you know you can prevent cervical cancer by doing a simple 5-yearly cervical screening test? The cervical screening test looks for human papillomavirus or HPV, which is the cause of almost all cervical cancers. Your test sample can be collected from your cervix by your healthcare provider, or you can collect the sample yourself from your vagina. Both test options are safe and accurate. Today, I'd like to answer some questions you've asked about cervical screening. So firstly, what is HPV? So HPV, or human papillomavirus, is a group of viruses transmitted through sexual contact. It includes any form of intimate genital-to-genital contact, including foreplay and non-penetrative sex. HP is very common, and almost all sexually active women and men will be infected with HPV at some point in their lives, and some may be repeatedly infected. It can also lie dormant in your body with no symptoms from a couple of months to a lifetime. There are more than 100 types of HPV. Most HPV infections clear up on their own, but some sometimes can develop into cancerous cells in the lining of your cervix. The next question is, are women not doing their cervical screening because they think the HPV Gardasil vaccine will protect them? So, even if you've had the HPV vaccination, you still need to do your cervical screening. The HPV vaccine protects against many forms of HPV, but not all of them. It's important you do your 5-yearly screening from 25 years of age because there are types of HPV that can cause cervical cancer that are not fully covered by the vaccine. Thirdly, what percentage of cervical cancer incidence in Australia is in women who have received the Gardasil vaccine? So AIHW data shows that women vaccinated against HPV are 41% less likely to show cervical changes that could develop into cancer than unvaccinated women. We also know the incidence of HPV in young people has decreased significantly since the HPV vaccine was added to the immunisation programme. HPV infection rates for young women has dropped from 22.7% to just 1.5%. Recent research shows also a decline in HPV in young males. Less HPV cases means less cervical cancer and less occurrence of other cancers caused by HPV, like anal and throat cancers. Fourthly, why is it only once every 5 years when cancer grows a lot faster than that? So the 5-yearly cervical screening test is more effective than the previous 2-yearly Pap test. The Pap test looked for cells changes in the cervix, whereas the cervical screening test looks for HPV. HPV can lead to cell changes in the cervix, and this causes almost all of the cervical cancers. HPV can take over a decade to develop into cancerous cells, so by screening we have time to monitor and treat HPV before it can develop any further. Aggressive, fast-growing cancers are very rare, usually diagnosed when a woman sees a healthcare provider or doctor noticing other symptoms. The National Cervical Screening Programme is for a routine screening programme for people without symptoms. If you have symptoms of cervical cancer, such as excessive bleeding, make sure you tell your healthcare provider straight away. And finally, are cervical screening tests done by a gynecologist? Yes, but cervical screening tests can be done by a general practitioner, a nurse, midwife, healthcare provider, or a medical specialist, including gynecologists. You can also take your own test in a private space at your healthcare provider's office using a simple swab. The test is free under Medicare, but do check with your healthcare provider about any consultation costs. A cervical screening should be done every 5 years by women and people with a cervix aged between 25 and 74. If we can detect and treat early enough, we can prevent cervical cancer. Contact your healthcare provider to find out if you're due to screen, and if you are, book an appointment today. It could save your life. And for more information, visit health.gov.au/NCSP. Thank you for watching today.